Welcome back to Mental Health in Our Community, y'all. It's Dr. Lawanda Hill, and I'm excited to introduce this next condition within this series. And we're going to be talking about premenstrual dysphoric disorder, referred to as PMDD. It is to be distinguished from PMS, which 75% of women experience PMS symptoms, but about 6% of women experience premenstrual dysphoric symptoms, referred to as PMDD. And we're going to take a deep dive into this episode. As usual, we're going to ask ourselves those 5 essential questions when trying to determine if we have a mental health condition. What are the symptoms? How many of those symptoms are we experiencing at a time? How frequent do we experience those symptoms? In this particular instance, do we experience these symptoms monthly? And more specifically, have we experienced them for at least 12 of the months in the past year? Okay, so what are the symptoms? How many? How frequent do we experience these symptoms? How often do they come? Are they cyclical? And to what extent are they interrupting our functioning, meaning our day-to-day life, our capacity to get things done, get work done? Is it impacting our relationships, how we're interacting with other people? So get ready, sit back, relax, tune in, and let's hop into PMDD. Let's get into PMDD and what are the symptoms and what makes it a mental health diagnosis. So I want to start off by saying that PMDD is a deviation from your norm, as in most mental health conditions. When I say a deviation from your norm, I'm meaning on a typical day, your mood may be high energy, it may be jovial, it may be happy, or it could be kind of like low energy, but you feel solid, you feel stable. For some people, it could even be irritable or moody, but by and large, you feel good, you feel grounded, you feel hopeful at the very minimum about the future. You have positive activities and things that you engage in that bring you pleasure, that help you cope or just help you get through life. And you feel very good and very optimistic. When you begin to experience PMDD symptoms, there is a marked deviation in your mood. One of the first symptoms that I want to highlight is a severe emotional symptoms that come in the form of either anxiety, depression, anger, and irritability, or marked mood swings. Now, the reason why I feel like this condition kind of often goes undiagnosed is because we've learned to trivialize that generationally, right? Think about all the movies, think about all of the sitcoms or skits. When women begin to experience these symptoms like mood swings or notable depression or notable irritability or notable anger or notable anxiety, it gets trivialized, it gets minimized. In fact, it becomes a joke and we make fun of it. So a lot of women just feels like this is just me PMSing. Very different. When we're talking about PMDD, we're talking about a more severe set of emotional symptoms. Here is the thing, though. I'm going to talk about how they rise to the level of a mental health condition, because it's not just the symptoms. Remember, it's the symptoms, it's how many, it is how frequent we experience these symptoms, it is how long they last, and it is how much it disrupts functioning. Remember, those are always the 5 questions that we ask ourselves, okay? All right, so when we're talking about PMDD, we're talking about a severe emotional symptoms. Now, at least one of those categories that I just listed, it could be anger, it could be mood swings, it could be depression, it could be anxiety. Now, at least one of more of the following 5 symptoms must be also present, combined to total 5, right? So you need a major mood, a major severe emotional episode, and then you need one or more of the following symptoms that I'm getting ready to name, that total 5 symptoms in total. It could be decreased interest in usual activities. Okay, so work, school, friends, hobbies, things you used to enjoy, going bowling, watching a football game, going out with your girlfriends, going out with your boys for cocktails, those kinds of things do not bring you interest or the usual pleasure. Okay, you can also experience difficulty concentrating, and this often comes from intrusive thoughts, right? So those intrusive thoughts could be related to anxiety and worry. Those intrusive thoughts could be related to self-critique. It could be related to hopelessness. It could be related to passive suicidality, right? When we're talking about passive suicidality, that usually accompanies those depressive symptoms. We're talking about not necessarily feeling like I have an active will to die and a plan and a means and I'm going to execute it, but I'm thinking about, man, if I wasn't here, life would be easier, or you may be more open and welcoming to death than you usually would. That is what we would call passive suicidality, to be different from active suicidality, which you may experience when you're having a PMDD episode, which is I'm thinking about harming myself. I have an intent to harm myself. I have a plan to harm myself because I'm feeling hopeless. I'm feeling self-critical. I'm feeling like things are not going to be better, right? So you're having that difficulty concentrating, particularly because you're consumed with these negativity and these thoughts and these feelings, these severe emotional symptoms. You can experience a change in appetite, right? Either your appetite is poor and you don't really want to eat, or either you have specific food cravings and you're overeating. right? You can also experience feeling overwhelmed or out of control. Small things overwhelm you. Putting together a glass table. I had a client one time that says, usually to put together a table, I had a new table. I was excited about it, getting ready to put it up in my office, and I was having difficulty trying to figure out which piece went where, and it became overwhelming, right? That on a typical day outside of PMDD symptoms would just be a stressor, maybe irritating, and perhaps we can find more concentration to lock in and focus. But when you're in the middle of that PMDD episode and you have intrusive thoughts, when you have intense anger or mood swings or depression or anxiety, you have difficulty concentrating, your mood is feeling low, then this could feel overwhelming. Everyday stressors begin to feel overwhelming and you feel out of control. You can also feel fatigue or lethargy, right? Low energy, small tasks take a lot out of you, wipe you out, and or you don't even begin with a lot of energy to begin with. There's also physical symptoms such as bloating or breast tenderness, swelling joints, or muscle pain. So remember, when we're talking about mental health conditions, we want to think about what are the symptoms are we experiencing? And you must have at least 5 of the symptoms that I just mentioned. It could be intense anxiety, intense depression, intense irritability, anger, which is irritability can be irritability or anger or conflict in our relationships, and or significant, what we would call marked mood swings. Okay, one of those categories of emotions, followed by at least 4 of these other symptoms, which include a decreased interest in our usual activities, trouble concentrating, a change in our appetite, either we're overeating or we have specific food cravings. We have insomnia, meaning we're sleeping too much. We may be feeling overwhelmed or out of control. We may feel fatigue or lethargy, or we may feel physical symptoms such as bloating, breast tenderness, swelling, joint or muscle pain. Now, I know some of you may be saying, well, Dr. Hill, that kind of sound like PMS. PMS, which we're going to talk about in depth in the next episode, is more mild symptoms. Again, 75% of women experience PMS and those symptoms are mild. And here's the key distinction. We're talking about the duration of those symptoms and the frequency. Let's take a deeper dive. When we're talking about the frequency and the cycles of these symptoms, remember mental health conditions, some symptoms occur in cycles, what we call cyclical. Some symptoms are more persistent. PMDD has cycles of symptoms that we just described that occur at least a week prior to the onset of your cycle, which we would call menses, and then persist throughout your cycle into post, which leads to about 2 weeks. So when we're talking about this condition, we're talking about frequency and we're talking about cycles. So these symptoms must what we would call turn on, right? Remember, prior to them turning on, you're having a pretty good day. You're going about your day, or you having a pretty good week or a pretty good few weeks. These symptoms must turn on premenstrually and shut off again by the time the menstrual bleeding ends. So that's what makes it a notable episode. If you guys remember what I talked about with major depressive disorder is classified by how many episodes we have. So we're talking about PMDD. These symptoms must turn on prior to the start of your cycle and then turn off post your cycle, and then you go back to your baseline. Okay, we're not talking about persistence here. We may be getting into some other things, some other mental health conditions there, but we're talking about these symptoms turning on prior to and turning off after your cycle. They must be present for most of your menstrual cycles the year before, so about 12 cycles. These symptoms must impact your functioning. They're associated with distress. It impacts our relationships, it impacts our social functioning. We begin to either avoid activities or become shut down. We have decreased productivity at work. So if you have these symptoms, you experience them for at least 2 weeks with those identifiers that I listed. They have occurred in the majority of your cycles, and then they become disruptive. If you're experiencing these symptoms, believe it is going to be disruptive. It's going to be difficult for you to concentrate. It's going to be difficult for you to get tasks done. It's going to be difficult for you to be able to get work done. It is going to impact your relationships because your mood is low. People will see a notable difference in your mood, whether it be low, whether it be anxiousness, whether it be mood swings, whether it be anger. So it begins to impact your relationships, the disruption in the functioning. These symptoms, these cluster of symptoms collectively together for the majority of your cycles, for the duration of the time that we talked about, which is at about 2 weeks, and they begin to disrupt your functioning, rises to the level of premenstrual dysphoric disorder. Now, I know you may be like, my God, this whole time I'm thinking that this has just been a bad case of PMS, but the whole time I am having all these symptoms that meet criteria for premenstrual dysphoric disorder. Well, now you know. Now, notably, not every severe emotional change that occurs is PMDD. PMDD is a severe emotional disturbance, okay, characterized by these other symptoms that I listed that are physical and also have to do with more cognitive functioning. But not every significant emotional change is PMDD. If you have another pre-existing condition like, say, major depressive disorder or generalized anxiety disorder or post-traumatic stress disorder, any other pre-existing condition, what would happen, such as anxiety or depression, you can experience premenstrual symptoms exacerbate. So if you're having a hard time differentiating, you feel like I'm having some symptoms, but I also have another diagnosis of major depression or anxiety, it's important for you to seek a mental health professional so you can get clarity on what is going on for you.